Imagine waking up sick today, but there is no hospital, no antibiotics, and no doctor who can explain what is happening inside your body. So how did people treat the sick before modern medicine? For people in the past, illness was a real mystery. When a fever rose or severe pain appeared, they had no way to see bacteria or understand the true cause. In many societies, explanations lean toward the spiritual. Some people believed illness was caused by evil spirits or the anger of supernatural forces.
That is why some treatments involved rituals, prayers, chants, or objects believed to protect the patient. Some could provide comfort, but that did not mean they treated the underlying disease. But not everything was superstition. People noticed that certain plants could ease pain or change particular symptoms, so they began using herbs as remedies. The problem was that they usually did not know the active compound or the correct dose. The same plant that might help could also harm someone when used incorrectly.
In ancient Egypt, we begin to see something closer to organized medical practice. There were healers, written remedies, and the use of honey, herbs, and other materials for different problems. Wounds were among the problems they could approach practically. They cleaned wounds, covered them, and used materials that helped protect them. Honey, for example, was used on wounds in some cultures, and we now know it can have useful properties in certain circumstances. But that does not mean every ancient remedy was safe or effective.
Then, thinkers and healers tried to explain disease through natural causes, rather than always connecting it to spirits. A major idea emerged: illness could have a cause within the body itself. But they knew nothing about germs. Instead, the theory of the four humors became influential. Health was believed to depend on the balance of certain fluids inside the body. If a healer believed illness came from an imbalance of these humors, treatment could involve trying to restore balance. This led to one of the most famous old practices: bloodletting. Bloodletting continued for centuries in different forms. Sometimes a patient might feel temporary relief, but in other cases it could weaken the body, especially when too much blood was lost. Now imagine the worst part: surgery. Before modern anesthesia, a patient could remain conscious during extremely painful procedures. That made surgery a last resort. They tried to reduce pain in different ways, including alcohol and plants with pain-relieving effects, but these were not true substitutes for modern anesthesia and carried serious risks.
And if you had a toothache back then, you were in trouble. One common solution was extraction, because they lacked modern ways to treat decay and preserve teeth. For broken bones and injuries, some practical methods were genuinely useful. Immobilizing a limb and reducing movement can help the body heal, even without understanding every detail of bones and tissues. But there was an enemy they could not see: infection. Even when a wound was treated, a person could die days later from something they did not understand. It was not because people were stupid. They were trying to solve a mystery without tools we now consider essential: microscopes, germ theory, anesthesia, antibiotics, and modern diagnosis.
Still, we cannot say ancient medicine was entirely wrong. People learned through observation and experience, discovering plants, wound care methods, and ideas about cleanliness and patient care. The major transformation came when medicine increasingly relied on scientific testing, anatomy, germ theory, and controlled experiments. The question changed from what do we believe causes disease to what can we prove causes it.
So, how did people treat the sick before modern medicine? There was no single answer. They used herbs, surgery, bandages, rituals, bloodletting, and observation. Some methods helped, others were dangerous. And the remarkable part is that modern medicine grew from those early attempts to understand disease with the limited tools people had.